welcome to Waranara's Yuran. I'm recording from the Gadigal land in the heart of Sydney, Australia. Waranara is a Gadigal name meaning to seek, which sums up the mission of our Health Professions Education Research Network here at the University of Sydney. And Yuran means many voices, which our podcast represents. So I'd like to pay my respects to the elders, past, present and emerging of all the lands on which we're present, and to all Aboriginal and Torres Strait Islander peoples listening. And with us are Doctors Belinda Kenny and Yobelli Jimenez. And we're here to talk about their paper, Ethics in Professional Practice, an education resource for health science students, published in the International Journal of Practice-Based Learning in Health and Social Care, Volume 7 of July 2019. And they published this with their colleagues Amanda Seaman, Laura de Michel, Kate Thompson, Natalie Pollard and Lindy McAllister. Good morning.
Hi, Lynn. Good morning, Lynn.
That's quite a lot of names to come out.
We were a big team.
You were a big team. I'm just wondering if we can start with you telling us a little bit about the background to the study and the kind of, what was the rationale that led you to do this research?
Thanks. Yeah, I might start with this one then. I'm really quite passionate about ethics. I guess I really see ethics as a cornerstone of professional practice. It's really about how we demonstrate our professional values in the way that we communicate and interact with our clients, with the community and also with our colleagues. So big interest in ethics, and I've been involved in ethics education for quite some time as well. With my work with the Speech Pathology Australia Board of Ethics, there's a real focus on proactive ethical practice, and by that I mean that as health professionals we don't just reach for our code of ethic when something goes wrong or we find ourselves in a horrible dilemma. We actually start to integrate ethics as part of our everyday practice and decision making. And I guess I'd really like to bring this proactive approach to the way that we educate students about ethics as well. I've done some ethics education and there's some challenges with it. I think one of the challenges is that sometimes students see ethics as a bit of a grey area. They think it's common sense. They have a sense that, well, I'm a good person and I joined this profession because I want to help people, so of course I'm not going to do anything unethical. So teaching ethics can be a little bit of a challenge. And I think the other thing is that I think we're really good at focusing on codes of ethics and students understanding, the importance of codes of ethics and what the principles mean. But there's still that gap between what the theory is and then what happens in practice. And I think that's where we really wanted to focus our project. Students who are going out for their external clinical placements, how can we prepare them to be proactive in their thinking about ethical practice? Would you agree, Yobelli?
Yes, definitely, Belinda.
Yeah.
So I think that's what attracted me to the project when I joined the team, that proactive approach, because as a clinician, I guess the only time that you might ever speak to a student about ethical practice is when something actually goes wrong. And by that stage, they haven't had the time to develop the skills or to find resources that they need to deal with ethical situations that they've encountered. So I really enjoyed that proactive approach that I hadn't actually seen in an educational resource before about, educational research.
I think it's really interesting because, ethics in practice is very different to ethics in theory as well. You're out there, things are happening in real time, you have to think on your feet. And for students, I guess, that they don't always witness the most ethical practice that they might. And so that also brings a kind of a dilemma.
I think that's right. I think that's really right. I think that really the healthcare environment is really complex, and I think professionals are really making a lot of quite difficult decisions, sometimes balancing, safety with, what their clients really would like, or they're looking at, how to help people make informed choices about the services that they're having. There's sometimes some real constraints around the resources that are available, and difficult decisions need to be made about prioritising. I think hard for health professionals to make those decisions. There's certainly ethical dilemmas there, but also for students sometimes to come to grips with that as well and think about, how am I going to manage that when I graduate?
So have either of you had any kind of personal experiences of students who have struggled with ethical issues?
Usually it's that misconceptions that Belinda mentioned before. So I'm a good person, I have good intentions, so I may never need to deal with an ethical issue. I think sometimes students find it difficult to join up that gap between, this is the theory I was taught, I've memorised my 4 bioethical principles, for example, but if I'm looking at a clinical scenario, they don't always recognise the bioethical issues within that actual scenario in clinical practice. And I think that's not necessarily the student's fault. I think a lot of that comes with experience, and to actually have that language of ethics to be able to communicate with others, their educators or clinicians or colleagues about that. So I think they need a strategy to deal with the circumstances, and certainly to identify them as well.
I couldn't agree more, actually, Yobelli, and I think for students, it's tough for them sometimes. They may be on an external placement, they may be concerned about perhaps some of the practices that they're seeing, or perhaps have difficulty navigating some of those professional relationships and boundaries, for example, on their placements. But at the end of the day, they are being assessed. Sometimes they don't feel really empowered to start a conversation about ethics, or to know where to go to get some support if they are concerned as well. They sometimes have that gut instinct, but they're not quite sure what to do about that at the time. And I think that's where sometimes after the placement we have those discussions with our students. We wish that those discussions had happened earlier, and that students felt that they did have some skills, or that they could reach out to us and get some resources to manage those situations.
And so that's what your paper's about.
That's really what we wanted to do. We really wanted to think about, how can we really prepare our students to, one, be able to identify ethical issues, so to know, is this just a general concern, or is there actually something ethical at stake here? We did use that bioethical principle approach, so to be able to identify, which of the principles here are at stake, and to think about some strategies that they could use to manage those ethical dilemmas. So that's what we really wanted to do. We wanted to make it really authentic, though, things that students would actually likely to be seeing in their practice.
I thought the other good thing about the resource was that there was actually a section on goals where students needed to develop their own goals. So I think that really they took a personal approach to, in the future, these are my goals for ethical practice when I go on clinical placement. So I think in terms of dealing and having that knowledge, I think that developing of goals is really what highlights, I think, part of this resource as well.
Absolutely, because it's action, it's knowledge, but it's thinking about, what's that going to mean for me? How am I going to shape my role as an ethical practitioner, and what's something specifically relating to ethics that I could work on when I go into my clinical placement?
I think that's really interesting, and I guess the other side of it is with ethics, more so than with any of the other skills that they're learning, that's not often very apparent as to what's happening, because it's often something that's hidden in the minds of their educators who are mulling over these things, but they won't be necessarily saying them out loud, unlike the other kind of clinical skills or communication skills.
Absolutely,
that they demonstrate.
I think that's right, and we know that even with clinical reasoning, as a holistic concept, that sometimes a lot of that's happening silently.
Yes.
And I think certainly ethics is exactly the same. And sometimes students don't always have that language of ethics, to be able to use the words around ethics to help them to perhaps communicate a concern as well, and to raise that in supervisory interactions, for example.
So let's talk a little bit about your study design. What did you do and why?
Well, we were lucky enough to have a successful strategic education innovation grant from the University of Sydney. So that was something that really helped us to develop this project. We felt that it was important to have a research framework around the educational resources that we were developing. We used a design-based research process. So that's an iterative process that involves cycles of design, implementation, feedback, looking at some early outcomes, and then redesigning the project. So it really was that cyclical project, wasn't it, Yobelli, during those early stages? And as part of that, we worked. You've mentioned that we had a big team then, an interprofessional team. So we were really lucky there because we had our own experiences with ethics, but also experiences from our colleagues from physio, rehabilitation counselling, diagnostic radiography, exercise physiology, and we really wanted to develop resources that had shared issues that were relevant across professions. So that was a really helpful process. We designed the cases together. We worked closely with the educational design team to help us have a project that was interactive on the online site, that the navigation didn't take away from the learning for the students. And we also included students fairly early as well to have some feedback about the cases, about the online environment, and what they felt they were learning as well.
Yep, so I think that's one of the key features, I think, of the project team, that they all came from a multidisciplinary area, yet we all communicated with that mutual understanding of the ethical processes that undergo in the different health fields. And really it was invaluable, I think, having all the different perspectives from all the different professional groups that were involved in the project. And then, of course, having the students give feedback. So in terms of the resource itself, the cases, like Belinda mentioned, were developed by groups. We had the ability to record them and then gain feedback from students. So students really initially gave us really good positive and negative feedback about the videos. Some of the things that we thought we were being quite clever with in terms of the wording of some of the questions. Students said, "Whoop, too hard, too long, too complex." So we had to go back and simplify some of those, which made perfect sense at the time, to have that independent, I guess, feedback from students. And students don't often hold back when they're asked for feedback, which was fantastic, to provide more value and easier access to the resource in the future. So some of the other issues we had were trying to make it a little bit more interactive, so students weren't just clicking through. So we had an idea, for example, that instead of just having text, we would have voices speaking through the text. So things like that I thought were a lot more interactive for students to go through. So we ended up with 5 cases on a Smart Sparrow platform, and students or educators could choose from one of the 5 cases to go through. And then once we had a main video for each of the cases, and then each of the scenarios were followed up by feedback from each of the characters in the videos themselves. So sometimes the student might have had one particular idea once they viewed the main video. Once they saw the different perspectives from everybody else or the other characters in the video, it, I think, may have potentially conflicted them more, and I think that just gave way to them realising how complex it is to actually look at everybody's perspectives in a scenario that potentially might have looked quite straightforward from the beginning, and then looking at other people's perspectives really brought home the fact that these issues are quite complex and there's not always a clear-cut solution to these problems. So that's when they were then taken on a critical reasoning strategy where they had to evaluate what information they could gather, what kind of bioethical principles were at stake, then come up with their own goals as well for future ethical practice.
Yeah, I thought those multi-perspectives were really important, weren't they, Yobelli?
That's right.
To have the opportunity to first of all sort of think about their own response to the dilemma, but then to think about the dilemma from other people's perspectives. I thought that was a really important part. And we did, though, cast the student as a central character. So the student wasn't sort of peripheral to the dilemma. Okay. They were right in the middle there, being part of it. So I think they enjoyed taking on that role of the student character as they looked at those ethical dilemmas. I do agree, though, that student feedback was very grounding
yes.
in the initial stages of design. And we had that challenge then because we had to think, okay, we didn't want it to become a ticker box, let's make it really easy. They can just click through, click, we've done this, we've done ethics. That's not what we wanted. We still wanted them to engage in that deeper level of thinking about ethics, but not to make it so difficult that they completely disengaged because it was too hard. So good process for us as a team, I think, to really think about, the students' learning and the level that they were at and how to scaffold that for them through the design process.
It sounds like an awful lot of work you were doing there, really thorough. In terms of your theoretical framework, how did you approach that?
Yeah, so clearly we're really about sort of adult learning. So I think probably our key design features were sort of drawn from reflective processes and also self-efficacy. So with reflective processes, we built in a number of different opportunities for students to reflect, and Yobelli's already referred to a couple of these. Early on, students would look at a scenario, they would reflect from their own perspective in the first instance. We then would encourage them to reflect from those different perspectives, consider different perspectives, and then at the end there was that action perspective. So, okay, this was your learning experience. What are you now going to do about that in terms of your own reflective practice? And that was included in our goal setting. We thought the self-efficacy part was really important, to include design features that we thought would facilitate self-efficacy, because we wanted our students to have that self-perception that, yes, we know about ethical practice, and yes, we have some skills here to be able to raise ethics during our clinical placement. That, I suppose, that sense of empowerment, wasn't it, that we thought about for our students, that confidence.
That's
as
right.
well.
And that it is a skill that you need to continually develop as well. So I think that was quite a key part of that.
Yes, yeah.
Well, I'm really excited about these scenarios. Are your resources available anywhere for others to access?
Yes, so in this paper that we're talking about today, we actually developed the resource on a Smart Sparrow site. At the moment, the education team at Sydney Uni are transferring that over to Canvas. So it will be available through a Canvas site in the near future. And it's actually housed within a wider range of ethical resources that we developed following this project as well. So it's a bit of a multi-resource Canvas site on ethical issues.
And we are really keen to share.
Yes, definitely.
The resources, that's the thing. We develop these resources. The more that they use, the more reach, the better. And I think they have been developed with the idea that educators can draw out things from the scenarios that they think are really relevant for their particular students as well.
And it sounds like you had a whole range of healthcare professionals involved, so it won't be specific to any one discipline.
Totally right. And we thought about different settings, so private practice setting, for example, one set in a hospital setting, one set in a non-government disability type service as well. So we tried to think about those different practice contexts as well.
Yep, they are quite varied. Yeah, so I guess study coordinators who want to use them can view the videos and see which one would suit their particular learning task best.
That's great. So what are you working on now? What's next?
Well, we're still keen on ethics.
Of course.
So with this particular project, Lynn, we have another stage to that where we'd really like to look at some of the outcomes, some of the learning outcomes. So great that we've designed this project, but we would like to actually see what a difference it might make to students. So the first step with that is looking, analysing the students' learning goals. So having a think about, once students have engaged with the resource and completed the learning activities, what sort of goals are they setting for themselves for practice? So that's our first stage there. And do you want to talk about the leadership project?
Sure. So I think the Enhancing Ethical Practice resource is quite a nice basic kind of introduction, but the follow-up, resource that was developed is called Leadership in Ethical Practice, where we put the student more in a leadership role in terms of taking charge of ethical decision-making and, building that culture of ethical practice in their future work environment. So it uses a different approach, so it has a narrative approach to ethical practice. And again, it's available on the Canvas site. We're also quite excited because we're also analysing through some of that student data. It's a great resource.
Oh, and it seems to flow nice at that idea of developing as ethical leaders, I think, for our students. Many of our students will be future leaders in their professions, and I think you can take a leadership role in terms of even individual client management around ethical practice as well. So we're excited to link that. We know how important it is to have ethical leaders, generally. So hopefully that will be a good contribution as well.
And hopefully it will actually be something that they can work with their own students later on when they become the clinical educators of the future.
That would be great.
Well, I'd like to thank you both. I've been speaking with Dr. Belinda Kenny and Yobelli Jimenez. We've been talking about their paper published in the International Journal of Practice-Based Learning in Health and Social Care. It's Ethics in Professional Practice, an educational resource for health sciences students in Volume 7, Number 1, July 2019.
You know